Making spiritual assessments. As we care for people, we are in ideal position to learn about their spiritual needs and resources. We do not need any special tools or equipment. We can use our own self. Our senses: eyes, ears, touch, smell, past experiences, our own faith, what we have learned from our education and training, what we have learned from caring for other people. We can draw upon the vast experiences that we have accumulated over time to help us assess the spiritual needs of the people we are with. How many times have you looked at a person or been with them for a little while, you said, their spirits are sure down today, or their spirits are really up today? You are making a spiritual assessment. What I am suggesting, what is part of your responsibility, is that what you have done occasionally in the past will now become an intentional part of your interaction with people. You will be assessing the well-being of their inner spirit. Talking about other clues which can inform your spiritual assessment of a patient. So in addition to your observations and your inner sense, there are some clues that can also assist in making spiritual assessment. Some of it include: are the usual supports like family, friends, place of worship missing? No one visits them, they may not be able to get out of their home. But it's important to know about their visitors. The person has just learned of a serious diagnosis. The person is waiting for results from testing, which will determine how serious the illness is and future treatments will be. Fifth, the person is talkative and needs more than you feel you can give. Sixth, person indicates they are lonely, bored, worried, or anxious. Seventh, the person is facing things which may be life-changing and life-transforming. 8. Person is dying. And 9. The person wants to talk about hopes, fears, values, and beliefs. In addressing spiritual needs, there are 5 things that we can observe or assist patient. The first is assess during your interview. When seeing the patient, ask about their spiritual or religious preference, if they want to see someone from their own religious background. Listen for verbal cues regarding spiritual or religious condition. Patient refers to God or higher power, or whether patient talks about prayer, worship, spiritual or religious leader. Look for cues on a patient's person and in the room for spiritual or religious orientation, where there's a Quran, Bible, Torah, symbols of items such as prayer beds, medals, or pins. Listen for significant comments. It's all in God's hands now. Why is this happening to me? Second is assess for signs of spiritual concerns, such as discouragement, mild anxiety, expressions of anticipatory grief, inability to participate in unusual spiritual practices, expressions of concerns about relationship with God or higher power, inability to obtain foods required by their beliefs. The third is assess for signs of spiritual distress, crying, expression of guilt, disturbance in sleep patterns, disrupted spiritual trust, feeling remote from God or higher power, moderate to severe anxiety, anger towards staff, family members, God or higher power, challenged belief or value system, and loss of meaning and purpose in life. Fourth is assess for signs of spiritual despair, loss of hope, refusal to communicate with loved ones, loss of spiritual belief, death wish, severe depression, flat affect, refusal to participate in a treatment. And fifth, assess for special religious concerns such as diet, refusal of blood transfusion, or needing to speak to someone from their own religious background.